Hello, ladies and gentlemen, and welcome to the future of the water and wastewater industry and the careers you did not know about. And I'm your host, Dave Kosminski, and we are live here at the Connecticut section, the CWWA Fall Conference. And I've got a very, very special guest that has taken time out of her schedule, to talk with us. So we have actually the keynote speaker, if you would, Commissioner of DPH, Dr. Manisha Juthani. Hi, Manisha. How are you?
I'm doing well. Thank you for having me.
Commissioner, thanks so much for taking time, and your presentation was actually very, very awesome. I know you do a lot of work, and your whole water team. So tell us, what drew you to the water industry?
So as an infectious disease doctor, I can say convincingly that safe drinking water is so essential to health. And really maintaining health, at the essence of that, is having safe water that you can reliably drink. And that is what drove me into public health in general, and why it's been so interesting to work with everybody who's working in the water industry.
Yes. Well, you've got a great team at the Department of Public Health, and I think I mentioned to you, Lori Matthew was actually when I launched this podcast, she was actually our first guest. And basically the premise of the whole launching the podcast was to basically make students aware of careers that are available within the water and wastewater industry, and that's why I kind of turned with the careers you didn't know about. Going back to your, school days and so forth, what formulated your career path?
So I'm a physician.
Okay.
And so as a physician, you go through medical school and residency. My residency was in internal medicine, and then did a fellowship in infectious diseases. Now, in that fellowship training is where you learn how to diagnose and then treat patients that have infectious diseases. But many of the patients who present with infectious disease complications may have been infected by contaminated water. When you think about things like E. coli, hepatitis A, cholera, and the list goes on and on around the world particularly, you realize how water is so essential. And so I was brought in as commissioner really because of my expertise with infectious diseases in general, and particularly with COVID in the middle of this pandemic. But those skills have been able to translate into the water industry.
Absolutely.
And one of the things I've been most struck by is the need for people who work in all different areas of the water industry. Because there are so many different levels of expertise that you need to be able to do this work, and public health in general has had a lot of people, young people, interested in it, particularly as this pandemic has evolved. And people are looking for ways that they can contribute to public health, and the water industry is a great way to do that, all these careers that you're talking about.
Absolutely. One of the things that I teach a water and people class, which is basically a class which allows students the opportunity as high school seniors to actually sit for the operator and training exam and be certified by the Department of Public Health. And the last 7 years I've been running what we call a water boot camp, which is in conjunction with the Metropolitan District. And it basically is a 2-week classroom, and then the second 2 weeks they embed them into the departments that they're interested in. And one of the exercises that I use when you talk about infectious diseases is that I introduce them to the pathogens, and they get to pick the pathogen, and then they basically do the research on the pathogen and say what causes it, what are the symptoms, what are the cures, and all of that kind of stuff. So obviously cholera and the Legionella, and so forth. Have there been any cases that you're aware of Legionella, in the state lately?
So we do have outbreaks every so often that occur, and of recent, I can't speak to a specific example, but what I can tell you historically is that we have cases that happen in healthcare settings. That's of course very problematic, and we want to make sure we protect our patients, because they obviously are coming in ill. But the aerosolization of water that can occur in various different places and then lead to infection is something that persists as a troubling issue that we have to deal with when it comes to water.
Yeah. And I think the other thing, as far as when we talk about the future of the water and wastewater industry, the umbrella of potential careers within that industry is just so large, and you don't necessarily have to go to college, but obviously, college education is, as far as is an advancement and get you, farther on in life. But it's amazing. When you were going back, roll back the calendar a few years and going into your college, your high school years and your college years, what were you thinking about?
So I'm the daughter of two physicians.
Okay.
And my parents came from India. And they were the immigrant generation, and they really encouraged education.
Okay.
I think education is the backdrop of what you can do.
Sure.
And in this country in particular, with education, so many doors can open.
Absolutely.
And like you said, so many of the jobs that are available in this industry, some may not require very high levels of advanced degrees, but we're trying to keep an open mind to be able to allow people to see a pathway and a growth in a career. So, it could be that you get started in this industry in an entry-level position, but education's only going to be able to help you advance within that. And so for me, that education route was within medicine. But there are a lot of other options out there,
absolutely.
and particularly in this industry.
Absolutely. We've had students that basically started out with a water utility as a meter reader or a construction, and so forth. And as, obviously the pathway for advancement is, very unlimited,
Sky's the limit.
And the thing is, unfortunately, as we go through life, our industry as well as infrastructure is aging, and we have to start refilling that pipeline. So anyway, I want to thank you so much for taking time, and sitting down, and thank you for a great speech. And ladies and gentlemen, we have our Commissioner of Public Health, Manisha Juthani.
Juthani, yes, absolutely.
Okay, Doctor, thank you so much.
Thank you.
For taking time, and we'll catch you on the rebound. We'll get this posted and get you up, and I'll send you a link.
Sounds great. Thanks for having
Doctor.
me.
All right, ladies and gentlemen, that's our flash here of a lightning round with Dr. Manisha Juthani, Commissioner of Department of Public Health. So thank you so much, Commissioner, and thank you so much for taking time. I'm your host, Dave Kosminski, and that is the careers that you didn't know about in the future of the water and wastewater industry.